We have a question here, Doctor.
Yes.
Back here at the back of the room.
Oh.
If we could honor the microphone.
Doctor, I think a lot of us now are beginning to think about what it would be like to be sitting in San Francisco. I was life flighted to Medford, and that was enough for me. But beyond how this would affect all of us personally, what I'm beginning to take this further out, if we had the sheriff here, how is this, I mean, John Alexander talked about a little bit about how it would affect the prison, but what about our sheriff's office, our probation department, both fire departments, all the EMTs, all the paramedics? I mean, every list of agency who uses that by law has to take care of a patient or a client. What's this going to do to our community cost-wise for all of these agencies? I mean, has there been cost analysis done that we could actually kind of put this on paper and look at this?
It's a great question. Now, Sheriff Wilson submitted a very strong court declaration in favor of the healthcare district's litigation, saying some of the things that you just said. You know, it was very well written, very powerful. Whether or not a cost analysis has been done, I don't know. But I met with Gary Blatnick, who's the public health servant, I think is his title, and he mentioned an interesting point. He said there's a huge backlog in law enforcement when they bring somebody who's committed a crime to the hospital. They can't release them from their custody until they're under the care in the emergency room. So when that emergency room is closed, it's a nightmare. And what if they need to be admitted and we don't have any beds? The prisoner, if he needs a hospital bed, Medicare and the federal government is very clear with what they call EMTALA regulations. That inmate will get treated at another hospital. So he's going to have to be accompanied somehow by sheriff's deputies. You can't just turn
we have to pay for that as
somebody's going to pay for it. Yeah, absolutely. I mean, that's a great question. This is one of these I'm going to write down as soon as the meeting's over. It's like, I never thought about that until you just said it. I thought about they'll be sitting, the sheriffs will be lined up in the hospital waiting the hours and hours it takes calling around. I mean, it can take 6 hours just to find a physician who has the specialty training and is available to take these patients. I mean, it's a nightmare. That's before you can get on the plane. So those inmates are going to be sitting in the waiting room with a sheriff's deputy all that time.
This would be my last one for the evening. Back when we had the initial meeting and I asked you if there were any federal aspects to this situation, and I pursued the question further to say, can we not get a federal injunction? I don't know if that played into our actual getting the injunction or not, but when I think about what happens if you have an emergency, the first thing you do is you call 911. Now, who is going to respond to the 911? Well, eventually, if it's a medical emergency, the doctors are going to be involved somewhere along the line. But first of all, we're going to go to our police, and then we're going to go to our sheriff. And after the sheriff, what happens? Well, we've gone to the end of our jurisdiction. After that, you get into the state police, and after that, you have to go to federal. So my question is, if you have any aspects of this situation that are violating a federal law, why can't you bring in the FBI or go before a grand jury?
I'll just say that's on our, we thought that one we did think about. I want to say one more thing. I forgot to tell you how regionalization ties into the accountable care organizations. My wife, who's standing over there, has done all the research, and I get all the credit, so thank you. But she read through the ACO laws, and it turns out to have an ACO among multiple hospitals, you have to have a single tax ID number for all the hospitals in the ACO. We have a unique tax ID number at Sutter Coast. If we regionalize, we become part of the tax ID number for the region. So then we qualify to be in the ACO. Now, this is just something that we read, but it would give reason as to why Sutter is behaving the way they are if they want to be part of these ACOs, and we know they do. I mean, they already are. So if we can keep from regionalizing, then they wouldn't be able to run the ACO through our hospital. So that might be part of the clue. Okay, I think we're going to finish a little early because the Obamacare information that I had, there's so much there, and I tied in the part that was the most directly related, but I don't think I'll start with that because it's a whole other topic, and I really appreciate the opportunity to be here tonight. Again, thank you all.